So, welcome all of our PCH members. I'm Julie Bordeaux. I'm the CEO and president of PCH Mutual, and you are a member by virtue of the fact that you have purchased our insurance and all of the wonderful free member benefits that go with it. And I'm here today with a colleague who I also consider a friend who has served PCH tirelessly since the time that I joined the organization in 2016 as a member of our defense council who defends members when they have claims, as the author of a treasure box of resources free to you in terms of documents that help you in serving your members and, serving your residents. And most recently, Rebecca Edelman has also founded GuidePath, and this is an organization and a platform that serves folks in the senior care industry who are looking to serve their residents by understanding who they are, who their loved ones are, what they care about, and it's a whole new way of addressing this environment. So I want to thank Rebecca for being here and joining us today to share GuidePath with all of our members. And also, I can never forget to thank you, members, for serving the most vulnerable. So thank you for that. And I will let Rebecca Edelman take it from here.
Well, Julie, thank you for that kind of introduction. And I want to reiterate, I'm Rebecca Edelman. I am the founder of GuidePath and also have been a proud partner with PCH for many years. And I'm really excited to be here today. I want to thank Julie and I want to thank everyone here, Laura Allison, everyone who is head of the leadership in PCH. I want to thank all of you who are joining us and those members and caregivers and industry leaders in your space that may watch this video later on, to thank you for caring, to thank you for all the work that you do day in and day out in whatever role that you play in your organization. And I feel very hopeful that today we're going to learn some things together and you're going to be able to engage with this special resource that PCH is providing us. I also want to just mention sometimes kind of the insurance domain gets a little cloudy or uncertain, or we don't quite understand, what does it mean to have an insurance partner? But in the event that there is any kind of a loss or a risk, this organization that you are a member of, PCH Mutual, that insures your risk, insures each of you and the folks that work for you, is one of the highest quality and most professional organizations in this space that I have ever worked with in, gosh, nearly 40 years. So I do want to shout that out because making choices about your insurance, how you choose your partners, how you spend your insurance dollars, etc., is so critically important. So I think this meeting today, PCH's commitment to sharing this information is all just an extension of who this organization is in our industry. It's just so well respected and things you don't necessarily see up front. So I just want to share that. And without further ado, let's get rolling. Julie mentioned that I am the founder of GuidePath. I'm a lawyer by trade. It might help to understand just for one moment again who I am. But so you're at my office here in Memphis, Tennessee. I'm a lawyer by trade, and I have been representing caregivers and operators and managers and owners in the senior living space for since 1990. So I've seen a lot of changes. I've watched the growth of the industry. I've been through many crises and many been fortunate enough to be part of a lot of opportunities for real sustainable change. And and several years ago, as part of the work that I do in risk management as a risk strategist and as a lawyer in the space, I founded GuidePath, and we're going to dive into it today. But um, uh, I want to sort of set the stage by, I guess, by emphasizing the fact that this value added resource to you as a member of PCH, no cost at all, is an opportunity to set expectations with your residents and the people that you care for, with your teams, with your residents' families. And this resource that we're going to talk about today, consider it like a conversation starter, okay? A lot of times when a resource is introduced or a risk management resource is introduced, we as an industry sort of think about more compliance than we think about conversation. So ditch any thoughts of like this being a compliance tool or some resource, and think about it as a conversation starter. So for me, the fewer surprises that we have, the better conversations we have, the better alignment we have with our residents and our families from day one. So this is what the program is called. It's the GuidePath Resident and Family Insights Survey. This document that's over here, the front page of the document, PCH participated, PCH members participated in a pilot of this Resident and Family Insights Survey Suite. And Julie, for anyone who would like to take a look at the white paper from that pilot, we'd be happy to distribute it. You can post it up as a resource. I think it's really interesting. We're going to be touching on it a little bit today. Um, and sort of the key takeaways for the just the resource itself is that to be thinking about that most risk really doesn't start with care. It starts with misaligned expectations. So this survey suite helps us understand those things before they show up as complaints, before they show up as disengagement or even claims. So you will see that the tool supports proactive risk mitigation, better staff experience, less guessing, for example, stronger family trust, and a culture change right at the front door. So kind of be thinking about those things in mind here when we talk about the survey suite. Um, so why the GuidePath survey suite matters? Why does it matter to you as members? Well, first of all, again, I want to just shout out to PCH for complimentary access to this resource. It's a powerful and easy to use risk management resource that really is specifically designed for small senior living communities and group homes like your own. So here's why it's important, in my opinion. Proactive risk mitigation. So identifying high risk expectations and communication gaps before they escalate into complaints or conflict or claims is one of the key benefits. I don't have these necessarily listed in order because the priorities may be different with each of your organizations. But I think that the proactivity and the risk mitigation is most important. Expectations management. We have to learn what residents and their families expect from us, from your communities, and then align our services with communications and accordingly with the communication. So, what are they expecting, and how do we then align our communications to them? Strong engagement with families and staff, creating trust-based relationships. Here's one thing. Well, we'll talk more detail, but one thing that's not changed since 1990 is that stronger engagements with families and staff create trust-based relationships, and using the survey insight to guide these meaningful interactions de-escalates stress and just improves the whole environment. That has not changed in the 35 years that I have been in this space. So and then improve staff experience and retention, empowering our teams with tools so they can handle complex situations with just more clarity or with more confidence is critically important and helpful, not only for retention, but I think also with recruitment and better culture, fewer surprises. So fostering a supportive, resident-centered environment that's built on transparency and alignment and care partnerships really just creates a better culture for everyone. So this is, GuidePath makes it really easy to implement. I'm excited to show you our demo here. So I'm going to keep rolling along. So this is the survey. This is what it is. This is actually what the tool is. It's a survey that arrives that you will create one here. You'll see it's a survey that gets created to either the resident or most times the resident's family member that has 25 questions in it. So it comes in their email like a survey. Or in our pilot program, we learned that many of our administrators or social services directors or missions coordinators really like to print the survey and use it as sort of icebreaker questions and fill it out. But then you've got to go into the portal and put the information in. But either way, it's a 25 question survey. It takes about 10 minutes to complete. That's designed to cover there's 5 areas of interest. And we're going to talk about the areas of interest are listed below. We're going to talk a little bit about why they're so important. But these 5 areas of interest are the ones that consistently, that we have learned over time, have consistently driving risk and also driving satisfaction. So it can be completed digitally, or as I said, it can be completed in person. And keep in mind, this is not an assessment. This isn't a clinical assessment. This is about experience. It's about expectations. It is about concerns. So we're asking questions that families already have in their mind, but in a structured, very supportive way. So that's what it is. And these are our 5 areas of interest. Because over and over and over again, over all the decades of being in senior living, communication, the family system, quality of life and goals of care, the aging process, and emotional and spiritual health are at the heart of misaligned expectations. So again, you get to see this in real time here in a minute.
And
I'm not going to spend.
Rebecca, I did want to point out that in developing this survey, you had experts who
Mm,
are social workers in this space, healthcare providers in this space,
yeah.
a number of people who had a wealth of experience that were able to isolate these areas of interest and the experiences that drove the development of this survey.
Yeah, and great point, Julie. I appreciate that contribution. And keep in mind too, we had the experiences of residents and the families themselves through at least 2,700 different depositions, statements, testimony over all these years. These are the issues that kept coming back. Nobody told me, nobody cared. I didn't know what my loved one's medical condition. Most of this information also came from the residents and the families themselves in the heart of litigation. So great points, Julie, about the origin of about the areas of interest and the experiences. Um, the slides are going to be made available to everyone, so I don't want to spend too much time here because I've kind of touched on it, but the areas of interest and why they're so important. Um, Communication, just a couple points in my own notes. Families want information, they want updates, and they want involvement. This is why communication is one of the areas of interest. This is what they tell us that they want. Okay. The family system, who's involved? What are the dynamics? What are the stress points? Okay. And as I've said many, many times, for those of you who know me, you know, there's your immediate family, and then there's your extended family, there's your family of choice, there's your family you're born into. The family system is very far reaching, and learning as much as we can about it is critically important about, in terms of building good relationships and caring. Quality of life and goals of care, couldn't be more important. The context of transitioning to our community, to your community, we want to find out what matters most to the resident and what matters most to their families. The aging process, fears around the aging process for the resident and their families, trying to understand the aging process and any prior experiences. The survey speaks to prior experiences that may be positive or negative in the healthcare industry. Certainly can drive complaints or concerns.
Because
Emotional,
that goes right to that trust that you talked
it
about,
does.
right, Rebecca? Yeah.
Straight up. And not only that, but it goes to the trust, but it's also if someone has a negative prior experience in a healthcare setting, one of the survey, when we did the survey pilot, one of the, and I might even have this on the slide, one of the feedback, I pulled some information out of one of the surveys, and one of the, because we asked people to in the survey, if they want to explain things, we give them room to explain. Did you have a negative health, have you had a negative or positive healthcare experience? They can check the box, but then they also have room to explain. And one family member said, yeah, I mean, I'm moving my mom. I moved my mom because we had a bad experience at another community. You may not know that. The family may not tell you that in advance, but giving them a safe space, a space that, is created specifically for us to find out what they need and what their experiences are, opens just the door to all sorts of really valuable information. So, um, emotional and spiritual health, often overlooked and often very high risk. So, the importance of spirituality, of religion, of cultural beliefs, fair or unfair, equitable treatment experiences in people's lives, right? Very important for us to find out about that, because unexpressed feelings and needs in this area clearly drive complaints and really drive a lot of other um, types of risks. So those are why the 5 areas of interest are so important. Um, so here is what we were going to see it, but here's what the survey looks like. So on the right side of the page, you're going to see what the survey looks like when you get it back. So after they fill out the questions, you're like, what does that look like? You've got a dashboard, which I'm sure everyone knows what the dashboards are. And you get to your dashboard and you can see what the Smith family, for example, the daughter filled out the survey. Let's take a look at what the survey results were and how we are rating this family, this resident. So the responses are in just the color code you see there, high, low, and medium. And each response is rated, and then it helps us. We're not labeling families or anything like, oh, here comes the high risk Adams family. What we're doing is we're giving our staff the ability to prioritize attention. That's how I like to educate and train around this. And it means sort of high risk doesn't mean a problem family. We want to get away from all of that and have more compassionate communication. But it could mean pay attention here early. Okay, how do we reframe that? These are areas where just pay attention early. This is kind of what the messaging in. So we have each question is rated, okay? And it's really nifty because in the side, that's why this matters. It explains why the medium and the high and the low, medium and the high, how to interpret the risk rating. And then it gives us some, it's like leadership visibility, right? Individual responses then also aggregate up. So across the top, you see the aggregate. So you see the aggregate in communication for this particular survey was high. And then you see, but each individual question is also rated. So we thought that was really important to have an aggregate and then also to have each individual question rated. Yeah, I mean, think about it. It helps us see trends. And Julie and I have talked about this many times. It's so important to see trends across communication, across these family stresses, across the aging process. It allows us and it allows PCH and your organizations to get a snapshot into, again, use this information as also quality improvement. And it's just useful training staff and having a focus and just culture improvement in our organizations.
Rebecca, what it makes me think of is, and just yesterday I was looking at an insurance journal that headline was how emotional intelligence factors into
Mm,
insurance and really everything we do. And when I look at this
interesting.
insight survey, it's like a roadmap to deploy your emotional intelligence, right? And
Wow,
to
yes.
and to see where what these families care the most about. And then what I love about GuidePath is we're not just giving you the information and the why in terms of why this matters. Then you're next going to show how we give you the tools and the training to talk to people whose areas of our interests are in these particular groups.
Yep, exactly. And again, later on down the road, I'm gonna, maybe next year, love to do a presentation on the program itself, on the education and the training, the larger picture, because that also fits in here too. And but yeah, really good points, Julie, and I appreciate that. Um, so the reason I created this next resource that is part of the survey suite is because what came up for me when we were building it was, uh-oh, what do you do if you've got, the Adams family are moving in, right? They've completed the survey, you've met with them, met with the family, and they've got a high risk area, right? So again, remember this, pay attention immediately, right? This is an opportunity to give some attention to this area. So one of the issues that came up for me is, okay, what do I do? It's Monday and they're going to be here at 4 o'clock in the afternoon. What do I do? Okay. So I thought it was really vitally important to create at least a roadmap where what you can do is set out for you immediately, or at least options. Okay. Alternatives. So this is where the survey suite becomes actionable. This is to Julie's point. And so for high risk areas, the roadmap offers really just practical, quick start steps. Okay. So for example, let's say it's high risk in the goals of care, right? Their circumstances, they don't have their advanced care planning. They don't know what their loved one really wants, whatever it might be. A simple kind of quick start step would be to schedule a goals of care conversation. Like they don't even need to know that you have your survey and they have color codes and high, mediums, and lows. You know that information. So you can share with them, we see here how important goals of care is to you. Why don't we schedule next week a goals of care conversation? Think about that. Think about if that happened. Or, for example, clarify the family role. So the family system, let's say it's somewhat dysfunctional and it shows up in red. The family system shows up in red, which it oftentimes does, as we know. Um, you could clarify the family's roles. Just, bring the family in. Say, why don't we schedule a family meeting? I see you have a lot of family that's going to be involved in caring. We want your expertise. Why don't we schedule a family meeting and start to clarify the roles of all the family members? All sorts of things that are contained in this high risk roadmap that are quick, that are actionable, literally you can do on the spot. Obviously, there are, this is about sustained change and sustained communication and caring, but sometimes you got to have something, no waiting, no guessing, just, this turns insights into actions like right away. So I think that that's really important. I love this roadmap, by the way. How you have children and
Yeah.
you're not supposed to have some that are your favorite,
Yeah.
but this one is one of
I, I, I
it's
love
one
that
of my
you,
favorites.
yes, it's your favorite. And what I think is so wonderful about this is the idea that humans need to be seen and heard. And
Yeah.
so this suite and this whole model allows our members to do that for their residents and their families at a very difficult time. But it's the added benefit of it is the benefit of being able to say, hey, we see you, we've been thinking about you more deeply.
Mm,
And so the path to trust is very quick when you can say,
mm,
we understand you have family issues. We've been thinking about this. We'd like to really
mm,
talk to you about it. It's nothing communicates more. We see you, we hear you, we're people you can trust than having this kind of platform to jump
mm.
off of to deepen those relationships.
And Julie, just to tag on to that, um, imagine your staff, right? You're also empowering your staff, training your staff, giving your staff resources so they know what to do. So that when a family member comes in to visit, or when, because usually it's our frontline day-to-day caregivers who are really the ones who are engaging them most, and you're giving them like tools and resources so they have what they need also to communicate and build relationships. And I think that's one thing that we have found about the survey suite and the Guide Path program overall is that the our teams want this. They want this. They want to know what to do when somebody is in need or has a question or is complaining or might be a high risk in an area. What do I do about that? Because it creates stress on them. So, giving them these kinds of these tools really helps. So again, it's just like as Michael Scott would say, it's just a win-win-win. So anyway, let's keep rolling along. So we did this survey pilot. And as I said, Julie, we can get the white paper up there and the annual report too for those people who might be interested for 2025. So we did a pilot with a bunch of different, several different types of um, providers, some group homes, some assisted living, some assisted living memory care, skilled. We had an array, and also in different parts of the country where cultures are very different. And we ran this pilot, and this is what you're going to see here is just some of the feedback. And these are the pilot results. I just thought this was kind of interesting. The and I guess the way I want you to interpret this is the area where the residents and families scored the highest risk across the board was in emotional and spiritual health. That was the area where the misalignment on expectations and understanding was the highest. Second was communications, and then there's just a variety of things in between. But you can see it, and I'm not really surprised by all of this. Goals of care, again, I'm just this is macro, analysis, but I thought it was really interesting that emotional and spiritual health were the highest in the risk ratings in terms of concerns that families had. So what a great opportunity, right? What a great opportunity to know that and be able to engage on that level. And I don't know, it's really, really powerful. So, um, a quick insight that it's a case study. So this is just like what early intervention really looks like. I thought this would be nice to have a little case study. So this is an area of interest with the most potential for risk, which was the aging process, followed by emotional and spiritual health from this survey. So Mrs. Smith, obviously the names are changed. She moved her mother from one community where she had several negative experiences to a new community, to your community, for example. She cared for her mother at home for almost 20 years. And then she stated that it was a horrible experience watching her mother's health decline. It's the information we got out of the survey, both from the questions themselves and then from some extra information she shared. She worried that her mom wasn't going to be kept comfortable. She would unnecessarily suffer. She was worried her mom's emotional needs wouldn't be met. And she placed the highest importance on spiritual and religious needs for her mother's continued care planning. Okay. Her mother was had a devout religious background. Um, so the comment here that she wrote in the um, survey was this: I'd like the nonprofit hospice to be involved. This is what she wanted for her mother. I'd like the nonprofit hospice to be involved in one, both a priest or a clergy, could be involved to make my mom feel close to or provide last rites. That would probably be someone from, and then there was a church. I should call them to ask if this particular nun would mind doing that. What a great piece of information. Because when our administrator met with this family member, met with Miss Smith, she got to talk about this. What can we do to help you? Call the church. And I remember this resident also, one of the things she was going to miss was her book club. There was like a book club issue in this too. And we were able to actually have someone from the church come and read for her. It was just like a perfect situation. Julie, I did want to make one point too is most of the initiatives here are zero cost, zero cost. Um, the cost of time and then cost of engagement is really all it is. But it didn't cost
Okay.
anything to connect this particular church with someone and a volunteer there who was willing to come and read once a week for Miss Smith's mom. So,
Yes.
and it went, the mileage off of that, the trust, the relationships, and from there, I think we started a book club. I learned later that the little book club was formed with volunteers. It was just a beautiful experience.
Yeah. The
Um,
desire for community
mm,
is a really strong pull, and I think people want it more and more, especially
yes.
today.
Yeah,
Yeah.
great point, Julie. So these are the insights from the survey again on the aging process. If you remember that category, it's a horrible experience watching her deteriorate. I've been feeling this way for a long time, probably since COVID, when she became housebound and stopped doing her book club and church. Yeah, this was Mrs. Book Club and church clubs and going out. She lost a lot of friends and elderly family members who were phone buddies. I worry that she won't be kept comfortable. Having this information opened up a whole group of opportunities for us to engage and to attend to the fears and the worries and the concerns of the family. Keep in mind, she's been taking care of her mom for 20 years. I mean, she had a lot invested. It's not just a change in the residents' life that when they come to us, it's a change in their whole ecosystem, including all the family members. So this was a way for us to really speak to all the family members. So the community used the responses to begin meaningful conversations with Ms. Smith and her mother about goals of care, aging process, emotional and spiritual needs. And then they used the high risk roadmap to connect on a deeper level with her about her new role in the community. I remember interviewing the administrator and her telling me that she was able to talk to Mrs. Smith, the daughter, and explain to her that she was one of our care partners. She wasn't just a visitor. She's like literally a partner in care. And so that also went a long way. So these are really just really important, very poignant insights. We got a satisfaction, we got a marking from the pilot team. And I love this. The communities reported improved resident and family participation when the community administered the survey, asked the questions, printed a hard copy for the family to review in advance, etc. And one of our members, or one of our pilot members, said the survey should be an ongoing tool that's utilized quarterly within communities to increase positive communication and fact finding associated with concerns. So, again, really positive feedback.
And
Um,
Rebecca, in that suggestion, are you hearing that communities are saying these 5 areas of interest, they might change over the course of their residency? And so to re-engage with the survey could provide some other valuable insights as the care is ongoing.
that's a great point. And thank you for double clicking on that. That you're right. And one of the suggestions was to run the survey again. What would happen if you ran the survey a quarter into it, 2 quarters into it,
Mm.
a year into it? Um, we haven't run that pilot yet. We don't have that feedback yet. That would be something I think, Julie, in the long term, that would be really valuable information. And I think that was the intention of this comment. Um,
Yeah. Yeah.
um,
And since it's free from us, they can run as many surveys as they like. We,
as many
encourage
as
our members to put
yep,
together a model that works for their community, but
yep.
don't think it's just a one-off, is what this, I think, is saying.
Yeah, and Julie, I think also on our guide path, so we just finished our strategic plan for next year for 1 year, 3 year, 5 year. And our goal is to develop a survey a different type of survey that is rolled out at the halfway mark, like
Mhm.
you can roll it out whenever you want, but somewhere that is a follow-up survey, right?
Yeah. Yeah.
And to see if those colors have changed, right?
Yeah.
Great point.
And it also informs you, so it informs you how well your staff is
Mhm.
implementing these things and where you might want to seek a little extra training. And I
Yep.
know you'll be doing a demo, so you'll see where those
Yeah.
opportunities are too for training.
Yeah, for sure. Yeah, the training part of it is like really cool.
Yeah.
So then here's some magic right here. So you say to yourself, well, we get the survey and we see these different areas and we're empowering ourselves to respond to these high risk areas or any of these areas of interest, regardless of what the risk rating is. But what about the family? Maybe the family should have some education and some training, right? Maybe we could get some early engagement with the family on their own and share with them some information we think is vital, even before we meet them or shortly after we meet them. So we design this resident and family education series. Okay. So, and as you can see, and you'll see it in a minute, there are there's an introduction to the video series. Okay. And then, and sorry, I got distracted for a moment. I got distracted for a moment. So when the family completes the survey, okay, and it doesn't matter if the survey is completed in person or online, but let's say they complete the survey online. After they complete the survey, they get a link, okay, and the link takes them, and you'll see it here in a moment, to the Resident and Family Insight Survey Suite educational resources that they have available to them now and later. They can share it with other family members. They can share these resources. So, so they have this whole video library. So in each of these 5 areas of interest, we've created a very short, anywhere from 1 to 2 minute video that already starts to set expectations, starts to engage and normalizes the experience of coming into our communities, helps families understand what to expect, how roles can change, very important part of all of this, and then how to partner with our community. And it reduces sometimes repeated questions, and staff fatigue is another thing that we have found. So this education series, which is an extension of the survey, helps support family because staff obviously can't be everywhere at one time. So that's what this is, and I'm gonna show it to you here in a little bit. But and then we have a whole series of resources. And Julie, I know we'll share afterwards the Wisdom Center, but there are a lot of resources, not just outward facing, but internally. You can learn more about each of these 5 areas of interest in the resource center that PCH provides. So, so now we've got the survey suite, we've got tools, resources, and information for our staff to prioritize. We've got the family getting aligned with their expectations, with understanding what their new role could be, appreciating the fact that your community cares enough to even share these resources. And that's the survey suite. That is the whole suite. Now, what I want to do here, Julie, is I want to do a little demo. Now, because I'm not like you, Julie, I'm not technologically savvy.
You can do it, Rebecca. You
I'm
can
gonna
do it.
do it. Go, go. So, so, and Julie's going to show you on CareCron where everything lives. But if you are going to access the survey suite, this is what will happen. You will see the following. You will arrive here at this portal. This is I'm gonna call it a dashboard, but this is where you will land. So if you are, Morningside, a community and wherever you're, in Topeka, Kansas, and you log in, this is what you will see. You'll see a little video of me here that kind of is an introduction. And this is your home base. Let's just call it home base. This is where you'll create your surveys. This is where you will see the survey results. This is where you'll have access to the family resources, the high risk roadmap you see here. There's a 1-pager that just kind of explains guide path if you wanted to share something with the family and needed some talking points. And then here you can print the survey suite. So this is a handout. So if you want to print it. So this is your dashboard. So you say to yourself, okay, here I am. Now what do? I want to create a survey. The Adams family's coming in on Wednesday, and we really are excited to have them come. And we've told them that we have a lot of great resources for them to educate them. Let's go create a survey. So Julie, you'll tell me if you can see these things as we go.
Yes.
Okay, hold on. Oh, check the box. Okay. So I got logged out there for a minute. So I'm not going to actually create a survey, Julie. I'm just going to walk them through what we would do and then show them the survey.
Of course.
But here's you're going to create a survey. So you can put the location, your location. You put a patient ID. So this could be anything. This could be any identifier because we needed to de-identify so we can protect you, the HIPAA protections. the resident's first name, the resident's last name, and then here the resident's date of birth and the recipient's relationship. So here we have a drop down. It could be themselves, it could be a parent, it could be a spouse, could be a sibling, could be a child, could be a caregiver, could be another. It doesn't matter. This is important for tracking purposes also. The resident care level, okay? Here we have assisted, memory care, and skilled. And it really doesn't matter. It is more for tracking. The survey doesn't change if you're assisted or if you're memory care or anything like that, but it allows you to see and utilize the portal in the best way possible. And then you put the email address in. So you put the email address in, and you go over here and you would submit it. Click, you would submit it. Okay. So they get the survey, and then you can go to your dashboard and you can go, oh, let me look at these pending surveys. I have all these surveys that I sent out and they're pending. I wonder when they're going to come back. And what might happen is the family's dragging their heels or they don't get it done or something goes on. You can resend it. And maybe you want to resend it and they're like, I don't have time to do it. Can you send it to my brother? You can go back in, you can resend, you can change the email and send it again. Or if they're like, we're just not coming to live with you, you can delete it. All right. And then these are the surveys that are received. So then you can look at your dashboard and say, oh, we've got a survey here from Sigourney Weaver. A little fun thing here. And let's go view it. These are your insights. And you just click on it and there you are. You're in your survey. And again, as I was sharing with you, why this question matters, this shows up every single time. This explains to you why this question matters. So for example, have you had a negative experience in a healthcare setting? Obviously, this person said yes, and they're high risk. And you could say a resident or family member with negative experiences is more likely to have anger, frustration, and mistrust. So this kind of helps you, contextualize the survey, the question, and where you might go with your what you're going to initiate your engagement. Okay, that's what it is, and we can keep going down. This is what it looks like. It's just a very simple, very straightforward. And from here, you actually can get to the roadmap, and you can just click on the roadmap. You're like, oh, it's a high risk, and oh no, So, and then you can go here and you can find, oh, they're high risk in communication. So here you have a plan. I explain here the goal, right, of the insight, and then the area of interest, and then a plan. And these are all different options. Use one more, just and use whatever you want if you want to create your own alternative way of managing something immediately. So that's what this looks like. And then I wanted to show you this. You have access right from the portal to the resident and family educational resources. This is what the family gets. I'm just saying, like, if I'm a family member and I'm in your community and I get this Welcome to GuidePath's Resident and Family Resource Center, and I get a bunch of videos that are in these areas, I'm going to run one. And I don't know if you'll be able to hear it, but I'm just going to do it for 1 second.
We can hear it.
They're just lovely too, by the way.
Welcome to the GuidePath Resident and Family Education Series on Communication that accompanies the Resident and Family Insight Survey. In your new community, there are many ways of communicating, including writing, phone calls, emails, text messages, and video. Effective communication between the residents, their family, and the community is a key to developing a transparent, trusting partnership and is related to a high quality of life.
I'm going to stop it there, but I think you get the point. So each of the videos touches on some of the questions. So they've answered the questions, and then they get a video to kind of reinforce and start to set expectations. So I'm loving that. And again, I do have some favorites. This is a favorite of mine. So anyway, so that is our, that's our demonstration. I'm going to go back here to from the current slide, and I want to have a sort of a proper transition here because Julie is going to now share with you PCH's platform and where you can find all these great resources. But I do want to just say that if I was going to pick one, there's many to pick from, but if I was going to pick one resource that I was going to implement immediately in my community to have the largest reach in resident and family and staff empowerment and engagement, this would be it. And I think that is why PCH has been an early adopter to GuidePath, has invested in you as a member and the membership in the organization to deliver this resource to you guys. And so I believe in it. And I'm always here for questions or any, even after the webinar, Julie, I'm certainly happy to, help facilitate initiation of things. So, and with that, I'm going to turn it over to Julie because she's going to talk now about where you can find some really valuable resources that PCH has created, and then where to find the survey really easily on CareCron.
Thank you, Rebecca. And feel free to post any questions in the chat, the Q&A section, and we'll be happy to answer them here or after the program. So all PCH members should be aware that we have a multitude of free member benefits. You can find them on our website, and I will highlight a few here because they do integrate with GuidePath. So the videos, thank you, Asha, our training videos. So again, like GuidePath, we understand that folks like short and sweet training videos, things that are essentially a jumping off point for you and your caregivers to train. So we have actually 2 videos on GuidePath in our YouTube, on our YouTube channel for anyone to watch who is a member. So it's Value of GuidePath, and then the next slide, Rebecca shows the other video that we have related to GuidePath.
Did I click the slide?
We have Value of GuidePath, then one more.
Oh, sorry.
Oh, other way.
There it is.
There it is. So this is also a little training and an introductory video for you and your caregivers, and gives you a little idea of how to work through GuidePath as well. And we encourage you to visit our YouTube channel anytime for the many training videos we have on all aspects of your business and in what you do. Next slide. And all of our members are very fortunate to have something else available to them, a very valuable resource in addition to GuidePath, which is CareCron, which is documentation software. So now free to all of our members, you can log into CareCron and you can access the whole platform that allows you to document and manage your residents' care in a very simple and easily navigable solution for your community. So in CareCron, you can also actually connect to GuidePath, because one of the really important things we feel about all of these wonderful member benefits we offer, the training videos, GuidePath, resident stories, our memory box, and our hotline, all of these things, and then our huge library of resources, all of these things aren't necessarily at your fingertips. You don't always know that they're there or see them when you need them. So CareCron is a place where you will be able to access all of our free member benefits to you. And GuidePath is highlighted in one of the most meaningful ways. So first of all, in the resource library, which is when you log into CareCron, which you can do at any time as a member, the login credentials have been sent to you. And if you need them, please reach out to us. But everyone who's a member has access to CareCron and can log in today. So you can navigate to carecron.com. When you log in on your account, you click on the resource library, which is at the top of the page on the right. And it will open this library here. And one of the things in the library is to GuidePath. So it gets you directly to GuidePath and all those wonderful resources that Rebecca just highlighted for you. There's another way that we can remind you about GuidePath and put it in your natural workflow when you're onboarding residents. So on the next slide, we have when you are onboarding a resident, creating their resident profile, so putting in their details like their name and their birth date and the move-in dates and their weight and those initial details. You will also be prompted as you're creating it to did the resident complete the GuidePath survey? Or in this case, we also have resident stories, which is another option to provide a full story of the resident so that other residents and caregivers can have some just personal facts about them that allow them to connect as human beings. And again, all dovetails into the same objectives of GuidePath in terms of providing the best care that you can. So from this prompt, you can click through on the GuidePath Resident Insight Survey, and that will actually get you to that login page that Rebecca showed you in the demo. And you have login credentials to set up your account in GuidePath. And so you'll be able to log in, and if you've already set up an account, you can log in right away and get to that dashboard that Rebecca showed you. So that's another way that you are prompted and reminded to get to the GuidePath survey, and you can access it through CareCron. So you don't have to separately navigate to GuidePath. You can do it through CareCron in your natural workflow of bringing in a new resident and setting up their profile on CareCron.
Oh, I'd like to make a comment here because I sort of learned about CareCron while we were preparing for this webinar, and I just want to let everyone know how innovative and how time efficient and effective having your resources in the CareCron is. And I just again want to applaud PCH and this leadership for, because making the accessibility is really so critically important, and most of the time is some kind of a hurdle or an obstacle to our teams. So really great. I mean, this is just great access.
Thank you so much, Rebecca. And for sure, the idea is frictionless, that this stuff can just all smoothly happen and doesn't take a lot of time, but everybody gets the resources they need, and then they go into the specific places that they need for access. So the next slide can show you that essentially, once you upload the GuidePath survey through this, you can have it as part of the resident toolkit, and you upload the documents from the survey, and that can all be in the resident's profile and easily accessible. So when you're talking about, well, do we think we've had some changes to the resident's experience here, and maybe the insights are different now? And so you can actually go into the resident's profile in CareCron. You can access any of their insight survey results, in addition to the other documents, the service plan, any incident reports, and multitude of documents that give you insight into the resident's experience at your community. And you can look at that survey and say, I think we're going to issue another one. And then from CareCron, you can navigate back and issue a new survey and upload version 2, the follow-up, whatever you want to name that survey for your operational procedures, you can do there in CareCron. So it provides you all of those things, easy access to getting to GuidePath and getting the insights that you need to best serve your residents, which I know is everyone's objective here. So
go ahead.
Go ahead, Rebecca.
No, go ahead.
No, that's kind of the last bit of my presentation about CareCron, at least. So,
well, I just really want to throw this in before it slipped my mind, which lately wouldn't be difficult. Is that using the insight survey also is important for new family members popping up. So, or different family members, or you learn that Mrs. Adams has a very, very close friend, who was taking care of her and wants to come and visit, and use the survey for everyone. because everyone's going to have really valuable information to share that will get reflected in the survey. So I really want to encourage that also. That was just all I was going to say there.
Yeah, and that's a really great point. But because even in my own family experience, with 5 children in my family, the person who was in charge changed, for circumstances beyond control, and so that you change some dynamics, most
Yeah.
definitely. And then we have also had, in talking to our members, we will have members who have not necessarily a loved one, excuse me, a family member loved one, but a loved one who is a dear friend, somebody who can provide tremendous insights. And so simply because there's not a family member involved does not mean that there isn't someone from whom you can get insights through using GuidePath and would appreciate all of the resources that we provide.
Yeah, great
So,
points, Julie. Great points.
yeah.
And as we're going to wrap up here in a few minutes, but be thinking about any questions for those of you who are joining us. Anything. I've got oh, we'll finish up. Julie, you want to answer some questions?
Yes, please. Let's answer the
Okay, cool.
question. You
Here's
see
our
that there?
contact. Here's our contact information. It says, once family members complete the survey, does GuidePath give us practical suggestions for ways in which staff can address concerns with the family? Yes, that is our high-risk roadmap. So once the survey comes back, those are the practical suggestions. So you can and the interesting thing is again, to accessibility, you can find the high risk roadmap right from the survey. You can open up the survey, read the survey insights, and you can go and have access to the high risk group. You don't even have to go back out anywhere. It's right there for you to access. So really nice. Thanks for asking the question, Allison.
And actually, what I would also say, Rebecca, is that those videos for the family are also worth viewing from the caregiver side to
Oh
kind of
yeah, great
understand
point.
what the family is hearing. That we've
Yeah.
reviewed those, and those are tremendously helpful as well, I think, for everybody involved.
That's a great point. It does give a lot of great talking points, and it also like makes the messaging consistent. And once you have watched the videos, it'll make the messaging consistent too. So great point. And plus,
Yes,
they're just great to watch. For
yes,
everyone learns something from them.
right. And I do want to say, I know you mentioned that in the future, we will probably do a webinar. So GuidePath has another dimension, and it's a certification program. And we have had our members undergo the certification program. So if you and your staff want to take a deep dive into these principles and concepts and do formal training, that is available through GuidePath directly. And we have had a board member who got tremendous benefit from that. And those learnings were transferred from staff member to staff member, even with the rapid staff overturn. They still were able to keep that knowledge and convey it to new staff members. So that was
Yeah.
really helpful.
Yeah. Thanks for mentioning that. It says, can we use the survey and the videos as a training and education tool? We can, particularly I can envision, and I've done this with I've done this with several of our groups, is to have have this be part of an in-servicing. You need your in-service hours, and frankly, I believe you could easily get credit for doing this and have this be accredited towards some continuing education for your staff. I think that, for example, if in your state you needed 10 hours of dementia care training, or you needed 10 hours of some kind of education and training, I think you could submit the program for 1 hour credit, if not more, but I would say 1 hour credit at a minimum.
Yeah. Yeah. And speaking of that, we have uh, in the looking to the future with PCH, we are rolling out some new toolkits, one related to healthcare providers and hospice care and other third-party service providers that come into your communities. So toolkits to assist you. We're planning a webinar on that, and we're hoping to, at least in some states, be able to have continuing education credit
Oh, great.
related to that. But we urge everyone to please log on to GuidePath and to CareCron and start using these free benefits. They're always going to be free to you. They're something that we are delighted to offer everyone. So thank you for joining us today. Thank you for the tremendous, important work that you do caring for
Thank-
others.
Yeah, and thanks
And
everybody.
thank you, Rebecca.
Yeah, we are so grateful, and thank you, OSHA, and the rest of this amazing PCH team. And we're here as needed. Everyone have a great
Yeah,
rest of the week. Stay warm and safe wherever you are.
absolutely. Thank
Okay.
you.
See you guys later.
Bye-bye.
Bye.
Bye.